I'm Sheetal Patel. I'm a board-certified general surgeon and fellowship-trained bariatric surgeon. My clinic is 360 Bariatrics, and we're based out of Plano, Texas. I've wanted to be a doctor since I was a very young individual. I actually grew up in East Africa and in Zambia, and my uncle was a physician there. We all lived in one big house, and he had a little clinic on the side of the house that was his secondary emergency clinic. And so I used to see all sorts of people coming in and day out. And I think that's when I really developed this sense of he was doing something really amazing. When I went for undergraduate to Baylor University, I think, like a lot of people, I started wondering, do I really want to do this? So after I graduated, I actually worked at UT Southwestern Medical Center in the Division of Plastic Surgery. And that sort of reignited my wanting to go into the medical field. Ultimately, I went to Texas Tech University for medical school. And at that time, I started to really gain an interest in surgery. And we used to see a lot of people with many different medical conditions and surgical complications that would come over from Mexico, from Juarez, Mexico. And that is when I really decided that, wow, this is a field for me. The bariatric practice is a very multidisciplinary practice. In fact, underneath me and in my clinic, we have dietitians and psychologists. Everything that a patient would need in order to achieve and get their goal of having a weight loss surgery. Being fellowship trained, I have the opportunity to perform complex procedures such as revisions. So we do the sleeve gastrectomy, the gastric bypass. And with regards to gastric banding, it is something that is somewhat going away and has spurred a whole host of patients who now need a revision. And so I do a lot of revision surgery where we take out gastric bands and revise them, convert them to either a gastric sleeve or a gastric bypass. And in my practice, the importance isn't simply placed on the procedure, but the care that a patient has to have beforehand to get them to that point. More importantly, after surgery, the help that they need, the assistance that they need is always underplayed. But once a person has had stomach surgery, they may not tolerate foods. They may have side effects or symptoms. And I pride myself on the fact that patients can get in touch with me, my dietitian, our psychologist, and any member of my staff at any time via phone calls or emails. And I usually inform my patients that if they send me an email, they will get a response back within 24, 48 hours for sure. One of the most wonderful things about performing weight loss surgery is to see a patient transform, not just physically, but emotionally and in spirit. 6 months after surgery, many times 3 months after surgery, patients will have transformed their lives. Not just the patient themselves, but even their loved ones. We have this thing we call the halo of health, where patients are going through the transition after their surgery, but their loved ones are doing exactly what they're doing and are losing weight and becoming physically fit and healthier. And so it's a family-oriented sort of a transition. But when I hear patients that say, wow, I can go to my son's baseball game and walk around, or the soccer game, and I'm up and down the field without running out of breath. When I have individuals that say, for once I can go for a walk and not have my knees ache. It's amazing to see that transformation. And it's even more remarkable to have patients say, I do not regret my decision one bit. Standards are very important when we talk about evidence-based medicine. And it is important because there is no point in trying to reinvent the wheel when it comes to patient safety, patients' outcomes. And in that respect, I think that standards are tremendously important and beneficial. And we try very hard to follow all of the guidelines and recommendations from all of the obesity societies in not just working up our patients, what happens to them in and around surgery to help prevent complications, and certainly the follow-up afterwards. It is absolutely necessary. Being a top 10 MD is tremendously important because this isn't a hospital, it isn't an insurance provider. that is evaluating me as a physician, as a person who practices medicine. It is a complete third-party, impartial group that has evaluated how I practice medicine, my training, my outcomes. All of that is very important.